So the chemical formaldehyde is all around us, and it is a known cause of cancer. It can also trigger asthma, miscarriages, and fertility problems. It's a really common chemical. It's used in industries ranging from furniture manufacturing to construction and plastics to healthcare and lab settings and even some beauty treatments. And then last week, the Environmental Protection Agency announced that it is revising an assessment of the health dangers posed by formaldehyde. So effectively what it did is it doubled what it had previously deemed to be a safe amount of exposure, which basically means that we'll all be more exposed to formaldehyde if you live in America. And then kind of moving on to kind of preventing disease through vaccine. So 2 weeks ago, RFK appointed CDC vaccination panel recommended that newborns should no longer receive the newborn hepatitis B vaccine, which was against all scientific advice, by the way. And then last week, Trump said that the US is going to reduce vaccines very substantially. He further said, falsely, by the way, he said, I think we take like 88 different shots all wrapped up into one big glass of stuff like that, and we're going to be reducing it very substantially. And he then ordered RFK Jr., the health secretary, to look into reorganizing the childhood vaccine schedule, to which RFK Jr. responded, thank you, Mr. President, we're on it. So as I kind of mentioned last week, while the CDC recommends vaccines, it's the Food and Drug Administration, or the FDA, that actually approves and regulates them. So while this is all going on, Vinay Prasad, who's director of the FDA Center for Biologics Evaluation and Research, announced wide-ranging but vague changes to vaccine regulations in an email, where he also claimed with no evidence that the COVID vaccination has killed children. So we don't know exactly what those changes are going to be, but we do know that that very same day, the CDC released a report on the effectiveness of last winter's COVID boosters for children, so 2024-25 winter. And that report said that basically last year's COVID booster for children reduced COVID-associated emergency department or urgent care visits by 75% in children under 5 and by 56% in older children.